researching it for the past few months. I chose this disease because it's one of the toughest mental illnesses we deal with in America, and I really wanted to understand it better. First, I'm going to start y'all off with a little bit about schizophrenia's history, who found it, and how they did. German psychiatrist Emil Kraepelin over here on picture one, he was the one who realized, oh, these people aren't nuts. It's just something's not going right up there. Something's not connecting. He was the first one to use the term dementia praecox to describe what we now know today as schizophrenia. So the second dude here in picture two, his name is Jürgen Buehler. He's a Swiss psychiatrist. He later on took what Emil did. He was inspired by it. He did further research and came up with the name schizophrenia. These two guys are who we have to thank for what we know about this disease today. Now, what's the issue? Why is schizophrenia schizophrenic? All right, so the issue is human glial cells that come from schizophrenic patients are highly dysfunctional. We are not sure why they're this way. All we know is something in the cell cycle is like jacked up, so it affects how these cells run. All right, so this wouldn't be a problem if in their cell cycle they weren't supposed to create other cells. Oligodendrocytes and astrocytes. These are myelinating cells that secrete myelin to talk to your brain, basically. Now, myelin communicates via pattern signaling, meaning that it's like lays on top of the brain and it doesn't go through the bloodstream. It communicates with extracellular matrix. That's basically what myelin is, since the oligodendrocytes and the astrocytes secrete it. Now, what's normal? What are your cells supposed to do? Normally, human glial cells, they go through their cell cycle and create the oligodendrocytes, and they create the astrocytes. These produce the myelin to bring the signals in your brain. But with schizophrenia, everything is delayed. Nothing happens on time. This is where the failure in cell communication comes into play. Not enough myelin, not enough communication. This is why schizophrenia is a cell communication disorder. Now, in this picture here, this is normal. This is how it's supposed to happen. But in schizophrenics, this gill cell right here is messed up, and these astrocytes and oligodendrocytes, there's not enough of them, so you don't get normal brain function in the end. And here are chromosomal differences. These mutations in chromosomes 1, 6, 8, 13, and 22, these all act as pre-markers for disease schizophrenia. This over here is a normal child, as you can see. And sadly, this child over here has every single pre-marker for the disease. You can also look them up for it if you want closer look at it. What is responsible for the miscommunication in schizophrenia is the metacortical pathway projection. And this right here is the metacortical pathway projection. And these lines here are dotted because it's showing that it's schizophrenia. Not enough dopamine is in this pathway here, and that leads to symptoms of schizophrenia. A lot of lines dotted, there's not enough going out here. And the pathway leads to frontal and temporal lobes, the outermost parts of your brain, which is your cerebral cortex. This affects most of your cognitive function, like how you move around, how fast you catch on to things, and stuff like that. Now, the causes of schizophrenia can range between what I just listed, the chromosomes, and then you have fluid field spaces in the middle of your brain. But because of schizophrenia and there not being enough myelinated tissue to cover the outside of your brain, the inside, those fluid field spaces are too big. I'll show you in the next slide. And there are a disorganization in how the cells are layered. There's not enough and more. The causes can be symptomatic dysregulation, which like messed up neurodevelopment, you don't understand things, and lack of sleep or drug exposure could be other causes of schizophrenia. These are what I was talking about. They're way too big. They're not supposed to be that large. And this thinning in the outside is due to glial cells in their beginning not being able to go through their processes and create the oligodendrocytes and the astrocytes to create the myelin and to make the cells move. It makes move. The myelinated cells are supposed to make up extra tissue on the outside. Stages of schizophrenia range between prodromal, active, and residual. In the prodromal stage, this is the first stage of schizophrenia. These are your hallmark symptoms, your depression, your nervousness, anxiety, and difficulty concentrating. And the active stage, sometimes called the acute stage, the second stage. This is where you experience, your positive symptoms, your hallucinations, your delusions. I'll elaborate on that in the next slide. Now, the last stage is the residual stage. People in the residual stage don't experience delusions or hallucinations. They usually experience like the back end, depressed mood, kind of like the first stage. Now, the symptoms of schizophrenia. Now, positive symptoms are like any change in thought or behavior, hallucinations, delusions. You've seen stuff that isn't there. Those are the positive symptoms of schizophrenia. Now, negative symptoms are like lack of motivation, not wanting to do anything, not wanting to be involved with anyone, social withdrawal, and emotional disorders like algoria, no interest in anything at all. Now, diagnosis, usually you'll go in because you think you're a little kooky, and then they ask you a bunch of questions about, do you see stuff that isn't there? Do you hear things you might not think that is there? And, they discuss family history, personal history, and they analyze to figure out if you have the disease. Now, awareness, Schizophrenia National Awareness Day is May 24th. Y'all can wear silver ribbons on that day because the national color is silver and people wear ribbons. And the symbol for schizophrenia is a puzzle piece. Now, treatments, there are only two right now. They're working on the third one, but the only two that work are antipsychotics and CBT. Now, antipsychotics keep the patient calm, keep them from having any episodes or whatnot. But the CBT is cognitive behavioral therapy. Usually in these sessions, a schizophrenic patient will sit with their doctor and they will work on like progress to reach their goals, try to get better. They don't focus on things in the past to avoid episodes, like I said. They focus on things that can fix in the present. There's no sure way to prevent schizophrenia. Early intervention and going to the doctor will help improve quality of life. And that's all I have.